Still loading. Go.
Still loading? Am I in the center?
Yes, you're in the center.
Okay, great. All right, over at Apex, we started here in 2004, many, many years ago, just when Ryan was just about to be born. A lot of stress in my life, positive stress, but it was an exciting time. I grew up in Oradell, so it was kind of a great area to be in. A lot of people, I'm attached to the community. It's great. I see people every once in a while that I went to high school with, and now as I get older, I'm seeing their kids and everything. So it's been a great experience being here, and I really love the area. Let's go next slide. Today, my big thing today is just to make sure you're more aware of like the ideas about where lower back pain sciatica may come from, little tips and tricks that maybe teach you how to manage it on your own. Hopefully you can take some steps on your own, start feeling a little bit better just on your own. A lot of times people think horrible pain means really complex things, meaning you need a surgery or injections to make a difference in something that you're experiencing. Sometimes horrible pain just needs a simple solution. It's just not as exciting as the latest injection and the latest surgery. It's not as sexy. But so today we're going to talk about understanding the McKenzie approach. It's just our way of looking at the back. We're just kind of how we systematically look at your movements and things like that, which we'll talk about, to understand how your back acts, because your back might be different from your back or my back or my son's back. How to make an informed decision about treating your own back. Make a decision, who do I have to talk to? Do I have to talk to my internist first? Do I need blood work? Do I need a simple x-ray? Or do I just need to show up at a therapist or a chiropractor, acupuncture? What do I need to do for the first step? It's scary. You don't want to make a wrong decision. We talked about the method, and then we'll talk about the tips of prevention of back pain and sciatica, which is some of my favorite stuff. So, next one. So, big thing we should do, I'm going to come over here just because we have the one, is understanding some of the risk factors, understanding what things may lead to it. If you're doing this, this may contribute to a problem. Unfortunately, if you had a back episode, most likely you're going to have another one. Now that's just statistically, you may actually have, if you start taking some of these steps and do some things, hopefully you don't have that second episode. Because unfortunately, the next episode is worse typically than the first. And that's the scary part. So if you can kind of take care of some of those risk factors, get involved with an exercise program, you'll decrease your risk of having that happen again. But that's a big risk factor. But I think it's smoking, actually. If you're a smoker, there's a lot of reasons why we should stop smoking. Probably, right? But smoking is a big risk factor for tissue healing. One of the things they find is like in the discs right here, this is Bucky, our skeleton. There's little disc segments, and these are like little shock absorbers in our back, and these are often the source of a lot of our pain problems, nerve root problems. There's a little disc right there. And there's small vessels that cut the disc apart. And like took a sliver out of it. There's the center of the disc, which we'll talk about a little bit, called the nucleus pulposus, fancy name. It's the center of a jelly donut. Then you have the rings outside of it. There's small vessels that go to this disc. And with the smokers, they think those small vessels are constricted and the area can't heal. So even whatever started the problem can't quite heal because those small vessels of smoking are obstructed and they don't get the blood to the area so we can heal. A lot of things affect that. A lot of things. Not just discs, but backs. They think that's one of the reasons why they're affected. So I think there's a lot of good reasons to stop smoking. But one of them might be affecting your back. In fact, some surgeons won't do surgery on you until you quit smoking for 3 months. They want to make sure they say, you're not going to mess up my surgery. Let's get you off the cigarettes. And you'll probably feel better in other areas too. Another risk factor, unfortunately, is obesity, extra weight. These are common things for a lot of health conditions, so why not? It's pretty much a physics thing. As we have more weight.
Mic.
Oh, my mic. Oh, my mic. Let's get the mic on. We have technical difficulties. Apparently we're not professionals at this.
Nice.
You'll learn from me. I admit mistakes, and I just have to roll with it here. So now we're going to talk about everything again. So anyway, so the next one is obesity, extra weight there. It is physics. There's more pressure through the lower back. If we can lessen that pressure, we may really actually start feeling better. And actually show that with people with arthritis of the knee, a little less pressure through the knee, it really can change the amount of pain and also the pain you have. I think the statistic is for 1 pound of body weight lost, it takes 3 to 5 pounds less torque off the knee. So I'm sure, we don't have the same study in the back, but I'm sure that affects the amount of pressure through those disc segments. And it's just good for us overall. Heavy physical work can be a trigger. Some of our construction people, they're doing like repetitive, especially repetitive lifting, leaning forward. Same idea, frequent bedding. Big thing here is static postures. Most of my people come to me, they haven't done CrossFit or done some incredible workout. They just went down to the shore for a 3-hour drive, and all of a sudden they came out, they couldn't walk. It's not necessarily that big lifting, these enormous things. It's just sitting in one position. We'll see accountants. They'll come out for taxis and they'll go, wow, I've been sitting 16-hour days. They all of a sudden trigger their back pain because they've been sitting much more than they're used to. I'm sorry, these chairs are the best chairs in the world, so if you ever want to stand up, ever have any problems, stand up, just move around. And one of the things I'll say is don't sit more than 30 minutes at a time. Just get up and move a little bit, just a little bit. You don't have to go for a walk, but just try and move a little bit. What was it?
On the plane.
Oh, the planes were. Yeah, and there's a lot of reasons on the plane to get up too. My uncle actually went to California. This is not a back issue. And he had some calf pain he was developing when he got out of the plane. And he thought it was a calf injury. He goes, it was from a fall he had just before the flight. He developed a clot. So so he's now on blood thinners for like close to 3 months. And he said, I think I should massage this thing, which is the last thing you want to do with a clot. I said, you know what? I think you might have a clot. And he said, okay. Sure enough, they did a Doppler, which is a little ultrasound. They found he had a clot. So yeah, getting up for clots are even a greater risk. That could lead to death. But he could have gotten a pulmonary embolism. So anyway, what I'll tell you, just because we're on the topic, is I'll tell people in the flights is to get up, which is very hard. The flights, they're all packed now. And they say just pumping your ankle for about 5 minutes will increase the circulation back to your heart. And it actually lasts for a good hour. So if you do it for an hour, do it for 5 minutes, it actually lasts for an hour. And it improves the circulation like 30 to 40% back to the heart. So decreases the risk. So. Another thing is lack of physical activity. Just decreasing stress, keeping moving, a walking program. It doesn't have to be a crazy intense lifting program or walking program, but it's something to get you moving. And that can be a big trigger. So just getting a simple walking program is one of the things I'll tell people. I don't know what to do. I'm like, just start walking. Get a dog. Start walking. Twisting and excessive lifting. One of the things with repetitive twisting and lifting is as you twist and you turn, that position, that's why golfers have such trouble, is they're over and they're turning. That is a perfect storm for a back problem. That puts a lot of pressure on the lower back segments right here and can really cause suppression in the lower back. So that repetitive activity over time sometimes can bring out a problem. And that's why golfers are known to have back problems. The great thing about golfers is they're incredibly motivated. They're obsessed to play, so they'll come to me very quickly if they can't do that. So, quick question is, when do you go see a doctor? When do you should pass me, you should go to the emergency room, you really should take care of the problem and not see a therapist. One of the big things is progressive weakness. And this isn't just because you haven't been working out. You'll all of a sudden notice that you're kind of clumsy, like your feet are clumsy, you have a hard time lifting your leg up to tie your shoes, but it's sudden, like it happens really fast and it gets bad really fast, like within 1 or 2 days. If you have that, you want to really get to a surgeon ER quickly because you may have something that's actually like a piece of disc material, like a portion of this disc might be resting on a nerve root that's going down to your leg. And if you have that on there for too long, you never get the strength back. So I always ask, have you gotten weak really fast? They go, well, I'm kind of weak because I haven't been working out because my back's not bothering me. It's different. It's more like all of a sudden you have lack of strength. All of a sudden you can't go downstairs, and you want to take care of that really quickly. There's another one, loss of bowel and bladder function. And what that means is you start urinating, you can't hold back your urine, or you can't get a bowel movement. That can happen with certain pain medications that you take. But we're talking about all of a sudden you can't expel, or you just start wetting your pants, to be very blunt. Or you can't hold it back. That is an ER visit. You do not let that go. You don't go, oh, the doctor said in 2 weeks I can see him. You have to see someone quickly. Because if that's not done quickly, you can lose the function. So even if you take whatever's going on in your back and you fix it, that's a case where you may not regain it. I have a friend of mine that actually has had a procedure. She's got a bag because she didn't take care of this issue, and the surgeon said, don't worry about it, don't worry about it. So sudden onset of balance problems, and that's very related to weakness. All of a sudden you're just not steady. That's a big no. Sometimes if you have a fever, that can be linked to some kind of infection that your body's dealing with. It's rare, doesn't happen as often, but that can be a sign that something in your body is trying to heal, or you have a bacterial infection or something, and that's linked to your back. Unexplained weight loss, that's the I wish question. I had some weight loss, I don't know where it came from. This weight loss can be related to cancer or something serious, but it's my I wish question. I wish I had weight loss. A recent fall or accident. This is interesting. As we get older, and if we have osteoporosis or let's say osteopenia, where the bone is a little more fragile, you don't need a major fall. I've had people with fractures of their lower back, and the woman said, I just stepped off a curb, and all of a sudden I got a jolt, and the lower back, I had a severe lower back pain, and it just never got better. It's very constant. It's there all the time. Like there's no position that makes me feel better. Those folks that are a little older, hopefully I don't write on my wall here. Those sometimes you don't need a big trauma to create a big problem, especially if you have a history of osteoporosis and severe and constant night pain. That also can be linked to a nasty infection or even cancer or tumor. Those are cases where, and the thing is, they'll tell me, they say, Tom, it never changes. It's the worst thing in my life. I don't care if I stand, sit, I take pain medications, it really doesn't change. That's sometimes a sign of something more serious, which we hope. But they're not as common. Like tumors are not that common in the lower back. It's just not that often you'll see that. So those are what I call the red flags. Saddle anesthesia. In your saddle, you have like numbness and such right around the anus and such. Pain below the knee, and history of cancer, which we kind of cover with the other ones. So those are red flags, and those are do not stop your therapist. Go to and see a doctor quickly. So I'm going to make this real quickly, but everyone talks about sciatica. And sciatica is really a symptom, it's not a condition. So what I mean by that is the sciatic nerve roots, the nerve roots that come off our lower back here, off these segments, all come together and form a sciatic nerve. Okay, so they all are kind of a bundle of nerves. Okay, it's the longest nerve in the body. As they go down, they go to different areas. They go to different muscles. They'll go to, let's say, the calf right here, or they'll go to the edge of the foot. They'll provide sensation. You'll feel numbness down here if the sciatic nerve is pinched. But just a large branch of nerves that come off of the lower spine and the sacrum area. When you get sciatica, something is irritating that nerve. When people go, I have sciatica, that's great. Well, what's irritating it? It's you have to know, is it getting pinched by something? Is there swelling? What's causing that nerve not to function? So when people say sciatica, that's good. It just means something pain going down the leg. But what's starting it? What's irritating that nerve root? Like I said, swelling can do it. A portion of that disc can come off, and like a herniation bulge can push onto that nerve root and cause different sensations down the leg. More common down the side, sometimes on both. Okay. These are some of the other nerve roots right here that show sciatic nerve coming off the lower lumbar spine. But sciatic is a common term you hear, and it's kind of a garbage term. So what is sciatica? We could talk about it as the longest nerve in the body. It's a common cause of sciatica. It's a problem with a disc in the lower lumbar spine. So one of these discs right here basically is coming out and pushing on the nerve roots as they exit down the lower leg. How is it diagnosed? True sciatica, like if you have a true nerve injury, you actually go ahead in there and they put a needle on these nerves and they see if the nerve is working well. It's kind of like they want to see how fast it's moving. And that's how it's truly made. We'll talk about MRIs later on. Does it get better on its own? A lot of these sciatica and back conditions, like 90%, get better over time, like 2 or 3 months. As long as you don't do something that's delaying it, you'll start feeling better, okay? If anything that's started there as far as the tissues, starts feeling better and it heals. The problem is that there's 10% that become our spinal fusions. People have chronic pain forever. And those are the folks that we get worried about. Those are the ones that can't work as much, or they have several problems as far as mobility. They stop going for walks. They can't go on that long drive. And that's the first portion that actually eats up all the healthcare dollars, that little 10%. Really, and it really impacts people. They shut down. They can't be as functional, and it affects their life. It's not life-threatening, but it really takes away from their enjoyment. So, this is the lower disc right here. This is the center. This is the jelly donut I was talking about. If you want to come up a little closer, you can see this. There's different rings here that go around. And that kind of holds that jelly donut in. When it becomes a problem, the material right here kind of pushes out. Sometimes it goes outside those rings and hits the nerve roots that exit real close to here. So you've got that little material, kind of pushes out the jelly, hits the nerve root, and it causes sometimes weakness or tingling or something down the leg. This is just showing your basic vertebral columns. So some of the back pain fiction. Who thinks you need an MRI and X-ray to treat back pain? Who thinks that's I have it right up there. Basically, you don't need the recommendation by physicians and therapists is that if you just started having back pain, to do an X-ray and MRI is not really necessary unless you're having like tremendous amount of weakness. You're having some of the things I was showing you on the red flags. fact, guess what they show with people that get MRIs that have back pain? They do worse if you do it too early. Because they see the MRI and they go, oh, I got all this horrible stuff in my back. Oh, my back's like thrown, is trashed. And they actually start shutting down. They're fearful, and then they actually show they do worse. MRIs and X-rays show a ton of stuff. Like they'll show like herniations, they'll show all these different things, and a lot of them aren't connected to your pain. They're just wear and tear. They're like the front tires of your car get a little worn down. So they provide some information to us, but they're not absolutely critical in the first couple of months, especially unless you have like horrific pain problems that are just over the top. So MRIs and X-rays are part of it. The interesting, they've done studies where they've done MRIs on people that have no back pain at all. They're completely normal. And 40 to 50%, almost 6% have herniations and bulges. And they go, wow, why don't I know those people have pain, and why do the other people do have pain? So it's just something that it's part of the whole picture. Another fiction is bed rest is often the key to feeling better. People say rest, stop, don't move. You got to let yourself heal. The recommendation now, they found if people sit in the bed too long, they actually do worse. The bed is initially kind of good, you're kind of comfortable, and then after about 3 days, they find those people that stay in the bed and the ones that everyone's taking care of them, they actually do worse. So the general recommendation that I'll tell people is move as tolerated. Try and do something. I'm not saying go for a run, but try and make a dinner or do some things or clean your room or just function as much as you can, as long as whatever you do doesn't really set you back. Okay, and that will keep you so you don't lose your strength, you lose your endurance. So try not to say, oh, I just got to rest for a couple weeks, because those folks do worse, unfortunately. We talked about this already. If you have a herniated disc on MRI, that is often the cause of pain. It's not true. It's just not true. And it's not just one study. It's like many studies they found. Do you need a physician before starting a course of physical therapy? Not necessarily. If you come to me and I said, or Nikki came to me and I said, I'm having this back problem, I would talk to her about weakness. Are you having any weakness? Are you horrible, severe night pain? Well, I have a fever. I've been having trouble, not to put you on trying my urine, I'm wetting my pants. I'm not seeing you. But other people that come in and say, I had this for a little while. I was sitting for a period of time. This pain's just kind of central lower back. I didn't have a fall. You can be seen by a therapist. They actually show that there's no greater risk to see a therapist at this point than a physician. And we're actually cheaper too. So another thing is I just need to strengthen my core. Core strengthening is part of a program, but it's not the only thing. If you have a loss of motion in your back, it's hard to strengthen your core. It actually makes it feel worse. Crunches, even like bird dog, all these strengthening or planks, sometimes will make it feel worse if you don't have enough range. And that's something we'll talk about here. They'll say, I haven't been doing my core, that's why I don't have a back problem. Not necessarily. So my goal for my patients is to have success, and I don't want you to put your head in the sand. If you let these things go longer, you start kind of pulling back your life and not doing things. My success is the day where your back pain sciatica is not the first thing you think about. That shouldn't be the first thing you think about when you wake up. You should be planning your day based on your sciatica and back pain. And I hate to hear people have that thought every day. I want you to understand success is what makes my back worse, what makes it better. How can I control it? Okay, I have to use a lumbar roll, be a little careful about lifting this, I have to go for a walk, maybe I have to get out of the car every hour going down the shore. I want you to know that I have control of the back, and I can change it. Things to do and avoid immediately when your back goes out. So your back kind of shifts out. What can you do that may make it better right there? I have people that come to me, well, I came to you about 2 years ago, back went out, what should I do? I'm like, well, try the same exercise you did when you were here, and I'll give them certain precautions. And sometimes like, wow, that made it feel better. And it's just a phone call. Knowing when to seek help is really my thing, knowing when you really should seek help. Sometimes you can't manage it on your own, and I kind of go through those things. You go back to that one.
I'm sorry.
And just we try and find as few simple exercises to manage your back pain. I don't want to give you a laundry list. The McKenzie system tries to give you 1 or 2 simple things to work on to help you kind of take care of your back. Anyone have any questions about this? We're kind of ripping through a few things. Any questions at all? I like it. You're standing up. You're getting I'm going to move around a little bit. Go walk back and forth. You can go outside for a little bit. I'll tell you what we talked about. What I don't want you to do is put your head in the sand and explain that it's just going to get better. Stop exercising because back pain increases. Your back pain increases when you do it. Slowly gain weight as you do less. Your lifestyle is kind of dictated by pain, distracted at work, kind of restricting family. I hate when I hear that. I'll talk to certain patients like, I don't want to go out anymore. Like, I don't want to go to the theater anymore. And that kills me because, it just impacts your life a great deal. All right, next slide. So a few years ago, I came out of school. Can I say about your background, being so Is has gotten into the physical therapy program at Rutgers, and I was in her position about in '95, many years ago. I think it was in dog days, and '95 and '98 I went to Miami. Came out of school, and I kind of did everything. Like, I did everything they gave me. Every new course I took, I tried a new shiny object, the new technique, the new stretch, the new whatever. I'd strengthen, stretch, balance, but I do all sorts of things. Every education course I did, I said, I'm going to solve every back pain patient from this new course. I'm so excited. And I'd come in, and my mentor at the time would be like, oh, I guess everyone's going to be hit with the same hammer. Everything's a nail, everything's a hammer. And I'm like, what do you mean, And I didn't really have an approach. There was no system to it. Like, I kind of had like a potpourri of things I do. And I was kind of excited. I was a new grad. I was going to save the world. No one would ever have back pain after they met Tom Wilhelm, little egomaniac. But I was excited. I wanted to help people. And what I realized is, like, I don't even know what works. I don't know if it's the stretching. I don't know if it's the strengthening. I don't know if they're just not doing things to bother them. I didn't even know really what was working. And that was frustrating as a therapist because I wanted to know that I actually made a difference, not that maybe they came to me to get better, maybe they would never get better. Maybe I had nothing to, maybe I was actually delaying their healing because I was doing too much. So I got kind of like a little bit disconcerted about it. And then eventually going back to taking some courses through the McKenzie Institute, and they gave me a systematic way of approaching treatment and evaluating someone. So finally I said, I'm having good results. Some people get better, some people don't. My results after doing the system is it went good to great. I really could tell when I could help someone, and I also knew when I couldn't help someone. I said, you know what, I just can't help you. For whatever reason, my approach is not the solution to your problem. Maybe you need to go to acupuncturist, maybe go to another therapist, maybe you need to talk to a surgeon. I may not be your solution. Generally, I'm able to tell people within 2 or 3 visits of taking them through the McKenzie evaluation whether I can help the patient. It does really, the biggest thing I have to tell people is you've got to do what I told you to do. If you don't do it, I won't know if it's going to work. So say, give me 2 or 3 days of doing this movement or stretch, and then I'll know if I have to adjust it. But within 2 or 3 visits, I generally know if you're a fast responder, a middle-of-the-road responder, or a slow responder. And there are slow responders. There are people that don't benefit from this, and they go right to more of a strengthening endurance program. The great thing is when I give you one stretch, we kind of know if it works. It's generally one exercise that we're giving the person, and that's when they'll take that home for 2 or 3 days and try it and see what happens. And I also talk about other things that you do while they're, but primarily it's one exercise. So McKenzie Math, after a thorough examination, we only come with one exercise that we hope reduces or turns down your back pain, or takes, even better if it takes it away. It's only one movement, okay? But in addition to taking you through these movements, we talk to you. We talk to you for a while. We want to make sure we understand where'd you come from, how long has it been going on, what were you doing beforehand, what led up to this, that's the most important part. And as a physical therapy student that Isa is going to do great with, she's going to talk to her patients and have the time to really understand them, and that's something we've lost in medicine. They said the average amount of time before a doctor interrupts a patient is 11 seconds. How long did I talk to people here?
Ooh,
Too long, I can't stop
20
talking. How much do I talk? I talk too much.
All day.
All day, unfortunately. So I talk too much, and I've been known to carry on. Ask Ryan, right, Ryan?
Oh,
I talk
geez.
yeah, I know. My son is running the...
Try to leave, and then you talk for another 15 minutes.
I'm
and
trying to
you're
always
telling
give
us
more
we need to
information,
leave.
but I hope that by more information, you can help yourself, and that's my goal. But sometimes I have a hard time cutting myself off. But that's a very important part. Any therapist, any communication, if the therapist starts talking over you, then you should start finding another therapist. Maybe not me, but someone that's going to listen to you. Because only you know your back. Can you back up just one
Oh,
note?
sorry.
Is that good? So after I started committing to this method, I have to say, things just started changing. I could see a pattern to it because it's very systematic, and there's a system of movements. It's not like try this, try that. It's like whack-a-mole. I thought out of school, which thing would work. This is a very systematic evaluation. We do things in standing, weight, non-weight bearing, weight bearing, and then we see which movements help you, and sometimes they don't. Next one. Robin McKenzie, great guy from New Zealand, really a funny guy, and developed a system back in the 50s and 60s. The treatment is based upon a response to movements. So I'll have someone do a series of, let's say, arches. Make sure I don't knock my mic off. Arches, or flexion, or I'll have them side bend. And I'm just trying to see, and I'll say, while they're doing it, I'll say, well, how is your pain acting? Is the pain going down? Is it moving up? What's going on with your pain at that position, with those movements? Sometimes I'll just prop someone up for like 5 minutes. I'll say, just lie on your stomach.
Tommy Mike's on.
Oh, think this guy's good. All right, that was my son Ryan. He ran away on him. Sometimes I'll prop up someone on their arms like this, and just prop and say, how's the back pain acting? I've never been in this position. I actually feel a little better, or I'm feeling worse. Okay, and that's not the right position. I may have them do a series of movements like this, or I'll even vary the movements. And the great thing is that I'm having the patient do the movements first before I go ahead and stretch them really quickly. And that typically makes the system safer, because you're going to stop before you hurt yourself most times. So we have them move, do a few things. We have them do it a few times to make sure we're not on the right path. We may do sustained movements, things like that. But that's basically the method. And Robin was ridiculed by surgeons. They said, you're going to hurt people by arching them or moving them like that. And later on, they said, wow, he's onto something. He actually won like an international award as a therapist. But when he started out, he was really criticized for what he was doing. All right, the disc model is, the reason why I talk about the disc, not everything's related to the disc. McKenzie said, we go by how the patient responds to movement. The pain might be coming from the disc, but we're really not sure. The idea about doing some of these movements is that, let me just explain with the disc here. So, this is a messy disc. You have the disc like this, and you have the center. When someone does it, this is a normal disc. When you have a bulge, this inner portion starts moving out. Like that. That's the portion that's not normal and is injured, they think, and can be causing some pain. As someone moves, the idea is that we're pinching that segment as we're arching, we're causing some pressure, and we're moving that material back to the center. And then that starts feeling better. And you'll see that the movements start feeling better going forward, back, side to side. But that repetitive movement starts moving the disc material to the center. Because a lot of the problems we feel are related to the disc. Not everything. There's SI joint problems, there's arthritic backs, things like that, but that's one of the main things I think is occurring. And with that movement, we're trying to balance the back and try and push that jelly back into the donut. That's the approach initially. McKenzie didn't really care what made better. He said, as long as the movement makes you feel better, you can call it a disc, you can call it a hamstring, you can call it whatever you want. Anyway, but it's really what movement makes you feel better. All right, let's say we go to the next one. Okay, does posture matter? Who thinks posture is? Now, when I came out of school, everyone talked about the perfect posture. Everyone's sitting up when we talk about posture. And when I talk about posture, I sit up. This woman's sitting there. I have no idea whether she has pain or not, but they actually find that even people with poor posture, sometimes they don't have pain. So why do certain people have pain with posture and other people don't? The big thing, I think, is just one position. If you're just here for 5 minutes, is that going to trigger the pain? Probably not. But if you're there for an hour, 2 hours, forward head, leaning forward, that could potentially do it. But there's a whole thing where people are saying, well, where does this whole idea about posture come from? And is it really true? My feeling is, if you can load everything evenly, it's probably better for you. But it doesn't mean that once in a while you slump forward, you're not going to have, your body's not that fragile. It's not going to all of a sudden fall apart. So I think it's good to think about posture, but it's not always linked to pain. Our kids, Ryan, that are sitting on the couch and they're leaning forward for 2 hours, they are developing more problems. You're just doing it for so darn long. I don't know how they do it. So anyway, this is the initial evaluation. We talked a little bit about this. First part is the history. We check your strength. That's what all these fancy medical words mean. We check your range of motion. We check your movements and see what kind of makes you feel better, what makes you feel worse. We also do a thing called, and this is good to know too, and this is something that'll help you on your own, centralization fertilization. And all that means is, if you have back pain, forgive me, I'm not the artist. My mom's the artist over there with those paintings. I need to get that gene apparently. So. Now Ryan's going to start laughing.
Yeah.
This is a cartoon character, apparently. Okay, so this is our back, this is our little thickness, this is our belt line right here. A lot of people will come to me and they'll say, Tom, I have pain right here, and then it extends down to this area right here. But it doesn't go any lower than that point. Centralization means when I'm doing the movement, or I'm doing the activity, and the pain starts moving up, say, wow, it's not here anymore, Tom, it's kind of up here. That's a good sign that a movement or position or stretch is helping you. You said, I did this other one, I was doing my hamstring stretch, I was leaning forward. My pain was here, and now it's kind of radiating down my leg, but it feels better, is typically not a good sign. Sometimes it actually feels better, excuse me. It's a little less intense, but it's radiating all the way down, especially if it's going below. I know this is not it, this is a knee. Sorry, knee goes down below here. That's a bad sign. So when we take you through the evaluation, we're often asking you, where's the pain going? Is it moving up or moving down? Is it getting worse? Is it getting better? But the fancy word, because in medicine we always have to make things sound complicated, is centralization versus peripheralization, meaning like up and down. Where does it move? Centralization, it goes up to where we think it's coming from, or peripheralization, it's actually moving down. But that guides us. That's really helpful for a therapist. And it also helps patients to know if they're doing something wrong or right. Because I can't be with you to do these exercises and watch you every moment. So I'll have people listen to this as you do it. Wow, I'm feeling better. Keep on doing it. Oh, it's moving up, it's moving up. Oh, it's gone. That's the perfect word. That's always a good sign. But that's what that concept is. And it helps you out, you know, if you're on a long drive, you're like, wow, my leg's starting to get numb, I'm starting to feel it. Get out of the car. Get a rest stop. Get on the side of the road. Do some arches. Or do some, whatever exercise I gave you. God, that's a really bad, that's just awful. If they think that if the artist equates a good therapist, no one's ever going to come here. Anyway, but you get the idea. Anyone have any questions about that?
Yeah, stick to therapy.
Stick to therapy? God, it hurts so much. All right, let's go ahead and, anyway, that's what makes it such a safe progression, is that people know when things are bad and when things are good. Everyone thinks therapy is like this torture chamber here. Like we're going to stretch you so aggressively that we're going to make you cry. It's really, if you're having pain, we actually are trying to reduce the pain with this system. Okay, it's not a no pain, no gain. All right, next one. So we talked about a few different things here. Loading strategies is what I mean by moving you. You know, we also have other exercises. Everyone talks about with the McKenzie method an arch. Some people will have them, it reduces their pain when they do a side arch like that. They do a side bend exercise. It's really based upon you and how your back acts, not so much what's the most popular. We'll also give you postural instructions. We'll give you a couple things that would make your back feel a little better. Not all of them are related to your pain. Some of them do help, some do, some don't. Range of motion, the self. This is a technique we do with people. We give you a little idea on lifting techniques using a lumbar roll. Eventually, when we have the pain controlled, we typically do work to spinal stabilization, which is a form of core, and we work on conditioning and endurance. Oftentimes, I'll give someone, my thing that I'll give people is I'll say, all right, we did the evaluation. I want you to do this one movement. I want you to walk as tolerated, okay? And I want you to use a roll or support for your lower back when you're sitting, just to prop your back up until you start feeling better. So that's like the triad, the three things I do. The most important is the movement. The second is not to trigger. Whatever you do that triggers it. You know, my readers are like, I like to read for hours. I forget, and all of a sudden I've been sitting there for 2 hours, an hour and a half, and then I was hobbled when I got up. So those are some things that we want to avoid because it makes it hard for the back to heal. And most people can heal with the right circumstance. Like I really believe the body can heal. It just needs the right exercise, the right movement, the right situation. Our bodies can heal. We're not that fragile, even if it's been going on a long time. So this is one of the exercises. Sure.
Could you talk about a little bit about icing versus heat?
Oh, that's a great question. I almost added that to the slide today. Can I show you this and then I'll go right to that? Yeah. So standing extension is one of the that's one of the most common movements that we check here, and it's one of the common exercises we eventually give people. We'll check their range, but then we also have them do it a series of times to see if there's an improvement. That's one of my top 3 exercises that I give. We also have it on our YouTube channel, a little video on that you can see, and I also talk about it a little bit more. Standing extension. Next one. Prone press up, that's another exercise. Anthony's he's a former aide here, he's now a PT for like 5 years. Makes me feel old. We don't have that painting anymore. Next one. Standing flexion sometimes is the remedy for a particular back problem. Next one. Knees to chest. Don't worry about unilateral flexion, I was getting too fancy. Flexing forward. And that's that shift correction. This is the one where you'll see people walking down the street and they're kind of like this. That's the stretch that sometimes helps them, is doing this. And a lot of times I'll have people do it a lot through the day. I'll say 10 times every 2 hours, do this particular stretch. Let's go to the next one. And this is me hugging Anthony. And sometimes they need a little help, and that's where the hands-on techniques come in. The first evaluation, most times they go, well, he didn't even touch me. I know. If I'm not sure, I don't do hands-on stretching until you do the movement yourself. Oh, wow, I was doing that movement. It's better, but it's not perfect like that. Then we start doing the stretches the second time you come in. Sometimes I'll jump into it. It matters. So the safety in the system is what we just talked about. You can know how the pain moves, tells us if you're doing a safe movement. Okay, and also you're going to do a lot of it, and you're going to kind of monitor yourself on how you respond and how your pain levels go. What's the next slide? Okay, I'm going to stop here because that was a question that came up. Thanks for asking that. So the big thing is ice or heat. Now, in the last few years, does everyone know what RICE means? RICE is rest, ice, compression, elevation. It's a sports thing that developed by this guy in the 70s, Dr. Merkin. Okay. The reason why I talk about it is he came up with rest, ice, compression, elevation. And he said all those things were supposed to reduce inflammation. And that's what ice is supposed to do, is reduce inflammation. And most people are told to ice for the first 2 or 3 days after injury. Twist your ankle, your back, you ice. So Dr. Merkin, he's still alive. He's 70 or 80 at this point right now, and he just had a blog came out, I guess, the last a couple of years. And he said, you know what? Maybe I was wrong. Maybe we don't want to ice everything aggressively. And what they found is that when we stop that icing, we stop that inflammation. Guess what? The inflammation's there to heal. It may hurt like heck, but it's trying to solve something. So when we ice it and we compress it, sometimes we actually irritate the same cells that the body's trying to heal. So sometimes icing actually causes more problems, especially if you do it very aggressively. You'll see some of our patients that come up for surgery, like shoulder surgery, knee surgery, and they're getting 20 minutes of ice, real intense ice. They're compressing it, and they actually show that the body can't heal as well. It's actually traumatizes the body a little bit. So this whole push among therapists to say, okay, who's icing and who's not. Once in a while I ice down here, but I've started to not ice people, especially people that have had conditions for a while. If you really want to, I would say do 10 minutes, light icing. It kind of numbs the area, it makes you feel a little good for a little while, which is probably why a lot of people keep on doing it. But stopping the inflammation, the body's trying to heal, and we're stopping it. So maybe we're doing something wrong. Maybe we're acting a little like godlike. I'm not going to get religion, but maybe maybe the body's smarter than us. The problem is it's really painful sometimes in the early stages. So we want to do something. So we try and ice it. We put all these different topical things on it. And that's the thing is that, so they're noticing that with ice. Okay, I'll get into heat in a second. The other thing too is they've shown that certain anti-inflammatories like Motrin, Advil, Celebrex, Spectra, some of these drugs that drop inflammation down, decrease bone healing, decrease tendon healing, decrease muscle healing. So I always tell people, listen, if you're really miserable, yes, take it. Realize there's a downside if you take it every day like a vitamin. There might be a downside to taking an anti-inflammatory. Also, there's concerns with some of the anti-inflammatories as far as bleeding. And we realize bleeding is that the cells, you stop the inflammation, nothing can clot. They can't tie together to heal everything. So it causes certain areas to break down. So constant use of anti-inflammatory sometimes hurts it. So what do we do with heat? Well, you just had an injury, and think it was like a big chemical reaction. It's like a fire. Like you just injured something. This is a tendon. You just had a tear in the tendon. All these cells come in to pull all this dead tissue that's from the injury. Okay, and it's hot. It's like every remember in chemistry class, and you put all the chemicals together, and it's like hot and it's boiling. That's going on in the body, and it hurts like heck. But to put heat on it right at that moment, I typically don't do that because I feel like you're putting gas on a fire. It's already really hot, a lot of chemicals going on, body's trying to heal, and you're going, you know what? We're going to turn up the oven to 500 from 300. Probably not a great idea to heat. Probably, if anything, we want to rest it for a little bit, maybe 3 days, not more than 3 for the back. 3 days, let it calm down a little, and then get some gentle movement. Even just, even if it's just like a little bit of movement for the back, or even like if it's an ankle injury, just some gentle movement. Just so after you get past about 3 to 5 days, after it's actually not really hot to the touch, like it's hard to tell in the back. Let's say you can feel your ankle go, wow, I just had an ankle sprain. That's still kind of hot. I probably wouldn't heat that area. I have this old injury I've had for 2 or 3 years. Heat it. May not help it. It's not going to hurt it. It may loosen it up. Sometimes I use heat actually as a prep for massage. I'll heat someone, they feel really comfortable, and allows me to loosen up. Because some of these muscles, if it's been going on for a while, get so tense they can't, even with a good movement, they can't relax. So I'll get in there and I'll massage. That's probably one of the times you'll see me use heat around here. Did I answer your question? Is there anything else about it? Yeah. You can ask me other things about it later on too. But yeah, that's the whole idea. But there's this whole thing about whether the ice, just like an anti-inflammatory, maybe it's delaying the healing in our efforts. But I think the reason why ice feels so good is it kind of numbs the area, so it does feel good for a little while, and that's why people continue ice. Same thing with some of the topical medication. Any thoughts on that as a future PT? Okay. Yeah, so those are some things. What about your clinic? Because you work as an aide. So tell me, do they ice a lot, or do they heat a lot? Or do they say anything about that?
Yeah, typically at the end of like each patient will either ice or heat. And we do a lot of like stim.
Bless him. Okay. Yeah, so there's different thoughts, and mine aren't necessarily right. It's just my particular angle, and there's lots of clinics that do it. Some PTs say, I'll never ice anyone again. I'm kind of somewhere in the middle, more towards, I don't know if the icing's really helping them. So, all right, that's kind of my thoughts. And I would say quote me and date me in timings, because my thoughts may change tomorrow based on new information. There's some interesting studies on that. So. All right, so recovery of function. All that means is once you feel good for about a week or so, Tom, the back's not feeling bad. Like I feel pretty good. Once in a while I feel a little tweaky. I'll start actually having you start doing some strengthening exercises. I'll push the endurance even more than I'm talking, like really push the endurance. Go for a run. And one thing's running is bad for backs. I'll tell you something about that. And education of like, what happens if it comes back? What do you do? But also, after we say, okay, this seemed to be the solution to your exercise, then I have you start moving everywhere. I want to test you. I want to see how do you feel? Let's start moving forward, start twisting. Oh, I feel pretty good. Didn't come back. Okay, let's go back to golf. Let's start getting back to living. Your life is not perfect posture. You can't move like that. You have to live. So once it gets under control, then you can start doing other things, and that's when we call the recovery function. That's the next phase. We start, okay, get back to your exercise classes. Let's get back to Zumba. Let's get back to fun. And we give them a plan. Let's try 15 minutes of Zumba, and let's see how you do. Wow, I did 15 minutes. Wasn't too bad. Okay, that means we're safe. Okay, let's do more. Let's do more. It's a lot of times people come here. It's what happens is they just go back too fast. It's more that they progress too fast, or they don't. It's how they take the steps. Like the same therapist that saw someone before. They went too quickly through the steps. It's not that they didn't do the right thing. It was just too quickly, or something like that. So we can get past this slide. We talked about this. Get rid of this. Self-management is the goal. We want you to be able to figure out how to manage this and figure out what to do, because you can take care of your back a lot. A lot of simple movements can make you feel better. We do want to be aware that this comes back a lot of times, and a lot of times it's worse. So we want you to be armed when you leave here. What can I do if I start getting the signs? Like most times it's like, I feel a little bit twingy, but it's nothing. That's the point when you just want to start going back to your exercises. All of a sudden you start noticing, wow, I can't lean back as far as I used to. It's getting hard to get out of the chair. Maybe you want to go back to those exercises, blow off the dust off that home exercise sheet you can't find anymore, and try the exercises before it gets really, really bad that you can't function. So those are some things I always want people to have that good information. Recognize the signs of back pain when returning, like we talked about. Some people will get, it's funny, I have my runners sometimes especially, and they'll say, wow, I feel like I've got my hamstrings, I have some hamstring injuries here or whatever, and that's an early sign that the back's starting to bother them. Start going back to, Tom said don't sit for more than 30 minutes, put it on your phone. Get up, move around. Funny thing is sometimes when you're sitting, you don't realize how much it's going to hurt you until you get out of the sitting. That's when it becomes a problem. So you really want to move proactively. Once you start feeling pretty good, is in the early stages, slowly add new activities as you feel more comfortable. Don't do your whole workout that you used to do. I'll tell people, as far as self-management, I like to get them into a walking program just generally. I like to have them make certain workstation changes to help them with sitting posture. Get an eye examination. We want to make sure they maintain their range. I know we have people do particular stretches. This is the most common one. And I'll say, okay, in your kitchen, stand in the same spot each time and see how far you can go. Which tile are you up to? You'll notice if you're losing range of motion. It's kind of one way to kind of see if you've lost it. Understand your triggers and adopt an anti-inflammatory diet. So a lot of times when we talked about there's severe pain or problems and we think there's like something catastrophic has happened. And the reason why I think about this, every time I think of an eye examination, I want to tell you a little story about this. I always think of this in back and neck problems. It's actually related to a neck problem. So my wife was, she's going to hate this because I tell this story all the time. She was, this is many years ago, probably about 5 years ago, started developing headaches and horrible neck pain. And she said, I think something's wrong. I think I have a tumor in my head. I think I have all these horrible things. You know, I'm going to die or whatever. And it was horrible. Don't get me wrong. I know the headaches were really bad. It was affecting her work. She really couldn't. And I said, listen, let's go ahead and do some tests. I did, you know, and I tried to have her do some movements, but she doesn't listen to me. So I said, why don't we try and stretch? No, it's not my neck or whatever. It's not. So we went to a neurologist in the city. And the neurologist went through a thorough history. Give him credit. He talked to us for probably half hour. And he said to her, he goes, I don't know what's wrong. I can't figure out. There's nothing that I see. He didn't do a test yet, but he said, based on this, I don't really know. She goes, well, that's it. And if you know my wife, she's very straight from the hip. He goes, all right, well, give up coffee, red wine, and chocolate. She goes, you might as well kill me. So he goes, well, I don't know. You came here. I'm telling you. She's like, I can't do coffee. So she's about to walk out. He goes, have you had your eyes checked? And she goes, I don't have eye problems. He goes, all right, well, go ahead and live with headaches, and maybe we'll get an MRI. So we went home. I said, are we going to give up chocolate, red wine? And she goes, no. I said, you going to get your eyes checked? No. So then I get a call, and she's at Walmart or wherever she's getting an eye examination. Shockingly, she had some loss. And she goes, this is ridiculous. There must be something wrong. So would you just wear the glasses? You're not going to be out. You don't have to do it while we're out. And, just do it in the privacy of your own home. Meanwhile, I'm always seeing it on her computer like this. I look the same way. So 6 to 8 weeks, no headaches, no neck pain. And all that was happening was she's slowly losing her vision. Make it sound like she's falling apart. Sorry, Sue. She's probably on this Facebook.
No.
And she's coming forward, and slowly the neck is getting into a position where it's triggering. Some of the nerves that exit the neck are giving a nasty headache. So, just to say, once in a while she has neck problems. I'm not saying so, but at that moment, it took the headaches away. She didn't do any special stretches. So my point about it is sometimes a simple movement and a simple solution to a nasty, scary problem can occur. Sometimes there are scary things. I'm not saying sometimes there's tumors and problems. I'm not trying to say that. But let's explore some simple things before we start making it, this horrible thing. And it's hard when you have a pain like that, you don't know, you're like, where is it coming from? There are people you hear about that had a brain tumor and had some infection and all that. But sometimes there's simple movements that you can do that can solve some kind of painful conditions. You just have to find the right movement, and it's not always easy to find it. So, if you're going to therapy, one of the things I will tell people, if you're going to therapy, ask your therapist, really communicate, have a very good dialogue. This isn't working. When do I should expect a change? If it's not working, what will we do if it doesn't? So you kind of have an idea of how long. I hate to hear some. I was at therapy 6 months. At the very end of 6 months, they said, surprise, it's not working anymore. That shouldn't be the result. It should be like, all right, we're making this change. Sometimes they just have to make a little change and talk to your therapist, ask about it, or your doctor, say, what else can we do before we look at more, aggressive things as far as management, whether it be injections, an MRI. People have claustrophobia. They're scared to death of MRIs. So kind of make sure you have that dialogue and you can explore that. Where are you going? We got technical difficulties. Technical difficulties. I think we're almost at the end here. What is this? The onus, the bonus? All right, we'll just go to the next one there.
Okay.
All right. So my 3 top exercises I told you I'd give you for lower back exercises. The first one we talked about a little bit. It's my most common one, especially for over 50. I'm over 50, so I can say this. Is the standing lumbar arch like that. So pressure on and pressure off. You have to get to the very end of the motion. Pressure on, pressure off. You can do it with your hands at your side. Like if you have a shoulder issue, you can put your hands at your side and do it. Pressure on, pressure off. That's one version of it. You've got to get to the end. A lot of times people have the same pain they're coming for as they arch. They'll say, wow, that's giving me pain when I go back there. I go, keep on doing it. Okay, I stopped. Not too bad. Maybe 3 to 5 minutes afterwards, maybe a few minutes, it's worse. But then, overall, I'm better. And also, wow, I'm starting to see a little bit better range of motion. So that's one of the exercises. And I'll tell people, so this is kind of hard to, you want to do this exercise 10 times every 2 hours. Okay? And that's about 5 sessions a day. That's the sweet spot. If you get to 5 sessions, we know after about 3 days whether this is a good movement for you. After 3 days, sometimes it needs 5 days, 3 to 5 days, we may have to change the movement or you need some hands-on. Okay, but that's what you would try and do. And you can't cram for a test. You can't say, oh, Tom said, let's say 10 times every 2 hours, I'll do 50 at night before I go to bed. You got to spread it throughout the day. Okay, so 10 times every 2 hours, get up every 30 minutes, light walking as tolerated, keep moving, right? Because that endurance and that walking program will de-stress you, and stress can be a very big trigger for back pain, which we didn't get into it as much, but that's something that we want to address too. That will de-stress you and you'll feel a little better. So 10 times every 2 hours, after 3 to 5 days, hopefully start feeling better, or starts moving the pain up, like my horrible diagram, starts moving it up, or now you have periods where, oh, it was gone for 3 hours, then it came back. That would be a sign that it's getting better, that we're on the right track. After 3 to 5 days, then we'll say, oh wow, it's not changing, actually getting worse. We're gonna reevaluate, we're gonna talk to them, what'd you do? Sometimes I did the exercise wrong. Sometimes I wasn't clear. And then we change it, we said, wow, I looked like that was gonna help you, we're gonna make a change, we're gonna change that exercise, okay? But typically it's around 3 days, 3 to 5 days before we see a change. We may see change, or before we know whether this is gonna help you. But you gotta get that 5 sessions in. Some patients will say, I did once a day, I did every day. Didn't change it. I go, keep on going, don't come back, cancel your appointment, wait till you get 3 days of doing it that often. The next exercise that's most common is, and this could be pain going down one side or both sides of the legs or in the buttock area. And you're just gonna, we did this a little bit earlier, it's doing a prone press up, hands like so, legs astride, all the way up, and you gotta get to the very end and let your hips sink and then back down. The hardest thing is this is like a push-up. If you haven't done a push-up in a while, people say, my back feels great, but my arms kill after doing this. So this one can be a little hard to do. That's my second. The one that's the least common of the 3 is a one where you just do a side glide. You basically, most times the pain is actually, so if you're doing this, the pain's on this side. Okay, so we'll either do it in standing, so we'll basically push our body this way, pressure on, pressure, we're going in this direction. So normally it's a pain on this side, that's the side we have our hand on. So pressure on, pressure off. The other thing is you can also do this with the use of a wall. So you place your hand on the wall, step a little bit away, hand like this, pressure on, pressure off, 10 times every 2 hours. 99.9% of the time, it's if you have it on one side, on one leg. It's always the painful side of the wall, away from the wall. So if you're by a wall, find a wall or a car, and the painful side away is basically pressure on, pressure off. It should not make you feel worse. You shouldn't feel weak afterwards. Sometimes you'll have 3 to 5 minutes, or like the first day after an evaluation, you're a little bit sore. Then the next day, you're still having trouble, you may have to stop. But this is supposed to take care of pain, not induce pain like long term. So, anyone have any questions? Tim, you have any questions? The future physical therapist assistant.
I see this all the time. I got it.
You got it? Yeah.
Got it.
It's pain. It's horrible. I mean, I had my first episode of back pain last year in lacrosse, and I was walking in the field. I couldn't walk slow enough, and balls are shooting past me because the kids are, don't know what's going on, and you feel paralyzed. And it got better by doing some stretches, but I was like, wow, this is what my patients are experiencing, and it's scary. I mean, I was like, oh, please don't cough. Like I would cough, and I was like, could you pick up that ball for me? I mean, I couldn't bend forward. And it got better, but it definitely, I have had chronic neck problems, so I do know necks and I know what to do, but it was the first time I personally experienced a back problem, so I do appreciate how scary it is. I'm like, I couldn't find one position that felt good. I was just like, I can't get any position. My wife's like, you're cranky. I'm like, I am cranky. So it affects your personality. Anyone have any questions about it? You can always talk to me afterwards. I have a thing called the Discovery Visit. If you ever want Facebook Live people, hey. We have a discovery visit. You can come in for 20 or 30 minutes. We just talk to you just to get a sense of what's going on, and we can give you some guidance. Sometimes we'll say, you know what, it sounds like you need some blood work. Maybe you have some systemic, something going on that's not related to movement. Maybe you need to have an x-ray. Sometimes you can start right away. But basically we talk for 20 or 30 minutes, and we talk about your problem and give you some information. And that's about it. One of the books that's a lot of what we're based on, or what my education's been in, this guy, Robin McKenzie, did Treat Your Own Back. It's a simple guide. You can get it off of Amazon. They show you the only thing I'll precaution you with this book, if you get it and you get really excited, like, Tom, I don't want to go here, I just want to try and figure this out at home. They give you all these exercises. You really want to just do one. I would try my top 3 first. There's other exercises in here. You should only do one first and see how you do. There's also things on posture, on things that might be making your back pain worse. It talks a little bit about the disc and a few different things regarding myths and things like that. But it's great information. It's right online if you want to get it. We can get you a link. Just talk to Kathy at the end if you want any of these things. We have them here too, but online you can get them on Amazon. What other thing? Oh, lumbar rolls. Let's talk about that. Unless someone has a question. I'll just say one thing before you leave. Everyone gets a lumbar roll since they're here. So let's get this this back. Hey Ryan, can you just grab that chair over there? Just as I'm going to rip the mic out if I do that. So it seems kind of simple, but using a lumbar roll for your lower back, all we're trying to do is, just throw this over there. Trying to do is keep that normal. This is a normal arch. This skeleton right here. The only thing abnormal is it's got a disc herniation. We're just trying to keep a little bit of an arch here when you're sitting. And all we're trying to do is get everything to rest kind of evenly in the lower back. So the lumbar roll sits right here. This is kind of your belt line. So to use the lumbar roll right, most times people, when it doesn't seem to help them. Sometimes it doesn't. It's just the back's too severely, because we want to make sure we get back into the chair as far as we can, so our buttocks against here. And we want to take the roll, place it, just kind of lean forward and lean back into the roll. So the roll is creating a little indent, if you guys can see it right there, and helping with that natural curve, because that's a normal curve. Everyone thinks of the back being straight. It's almost like a spring if you look at it. It's kind of like this and this. It's supposed to be, as you walk, kind of absorbing shock. So you're going to scoot back. You want to get your upper back so it almost curves over the roll, and like this. And that typically will feel better with sitting. Still, you want to get up every 30 minutes. You don't want to sit in the same position. So that's a lumbar support. I'm 195 pounds. Someone else that's 100 pounds may find their back's a little smaller, so sometimes you need a smaller roll. It should fit your back. It was like a friend of mine that was a big biker. I said, "What's the best bike seat?" He says, "The one that fits your ass." I go, "Oh, I tried." So yeah, so make sure you have the right roll for your back. Someone that's a big 250-pound guy, he made it a thicker roll and a little bit, a little thicker, a little bit more dense to support his back. So just keep that in mind. Driving, you should have it all the time. In the early stages, you want to be really careful about having this at all times, and most times it makes it feel a little bit better. Okay. Any questions with sleeping? Let's talk about that real quick, and we'll wrap up. Sleeping, or the best positions, I prefer not to have you lie on your stomach. I prefer more of a side sleeper. So when you sleep, I'll probably tear out my mic here, but I like to have people on their side. And all we're trying to do is get everything to stay neutral, so nothing's twisting at night. You rest on your side, and then you can take another pillow between your knees like that. That's typically the better position. Second best is on your back, if you're a back sleeper, and put a couple pillows underneath the back of your knee. In this position, they found that the lower back is the least amount of stress, the least amount of pressure into the lower back, with even a couple right there, lying flat. So those are two positions I prefer. Try, even if it feels good, try not to lie on your stomach, because typically it really feels worse as the night goes on. For me, I move the whole night, so it doesn't matter where I started, I end up somewhere else. So when my back is bothering me or neck, doesn't matter where I start, but that'll at least give you maybe a couple hours of sleep, and sleep's important. Any other questions before we wrap up?
Why not the stomach? I kind of prefer the stomach.
Yeah.
The stomach typically will put excessive pressure on the back. Even though I'll give you that exercise, it'll actually put so much pressure on the back that even a low level pressure over 8 hours will actually make it worse. It'll actually feel worse. Partly too because some of the muscles in the front of the hip will arch the back even more and really irritate it. So that's why we prefer not, in addition to a few other things. But some of it's based on experience.
Even if you put a pillow underneath your head.
That's a good point. All right, that's a great, Nikki. Yeah, some people say, listen, I want to sleep in my stomach. All right, let's try and do it so instead of, like, you know how we were lying down and your legs were up like that? So instead, to your point, Nikki, I love when people provide me a little feedback here. Placing your back more like this so it's not excessively arched at night. Even a little higher, like underneath your stomach to this area. Is sometimes people that really want to be in that position. So all right, you really want it, let's try it. And that'll put the back in a little different position and it'll relax the hips. So if you really are like, I gotta sleep in my stomach, you can do it that way. Also, it's not great for your neck because people, not that you have a neck problem, but you have to typically adjust your head when you're lying prone, what I call prone on your stomach. So sometimes that'll kind of tweak the neck, and if you get out of those habits, hopefully you don't develop a neck problem. Yeah, it's hard. It's hard to. People just like to sleep certain ways. It's not that it even hurts. It's just they prefer that way of sleeping. So sometimes it's hard to change that. So, any other questions? Great question.
Well, when I sleep on my stomach, I usually don't use any pillows. So like, I'll bend one leg.
One leg up and
one leg
another.
up.
Yeah, we get into these patterns of doing it, that you just kind of, that's the way I do it. All right, but it's not the whole picture. There's other things that affect that. You can maybe, I'm sure there's people sleeping on their stomach until they were 100 and never had any back problems. I'm just saying, you gotta see how your back acts, and see how it feels. Steve, you got any questions? Liz, any questions? All right, well, thanks so much for coming down. You can talk to Kathy about a discovery visit. If anyone online, Facebook Live, discovery visit, call us here. Share this if you benefited from it. Hopefully you did. And have a great day, and get out today and get to go for a walk. All right, thanks, guys. All right, well done. It's pretty good kicked off.